Okay, so we have this is Elena Acosta. She is 54 years old. She was admitted yesterday, diagnosed with pneumonia, and has been treated with fluids and antibiotics upon admission. Um, she mentioned she was having some stress and she's been drinking to cope with that. And this morning I started noticing she was having some signs of withdrawal, which she also mentioned she wasn't feeling well. She had a headache. Her lungs had improved. There was no crackles. Her O2 was at 95%, but she scored 2 on the CAGE assessment and was having some tremors and so uh, I believe the primary problem is alcohol withdrawal at this time. She has a past medical history of hypertension and she's taking hydrochlorothiazide. She also has anxiety, which she's taking Xanax for. Um, right now, she lives alone. She hasn't mentioned any nearby family. She lost her father about a year ago and has a stressful job. She says she's been self-medicating with alcohol and has admitted that should drink less, but she hasn't. She doesn't think it's an issue. She says she has to have a drink in the morning to calm her nerves. Her recent vitals are her temp's 99, her pulse is 110, her respirations are 20, her blood pressure is 154/92, her O2 stat is 95, but her pain is a 7 out of 10. Um, she's alert and oriented to person and place. Um, on initial assessment, she was alert and oriented to, or I'm sorry, she was alert and oriented currently to person, but she doesn't know where she is. But when we initially admitted her, she was alert and oriented times 3. Um, she's also having some slower speech, and her anxiety is a 7 out of 10, and she's denies any hallucinations, but she's also been pretty tearful and irritable at times. I contacted the physician to reassess and provide meds that will help with withdrawal symptoms. Her lab values that are relevant, her creatinine is 1.1, her Billy is 0.9, her ALT is 42, and I'd keep an eye on those due to her alcohol abuse. They might pull another metabolic panel. The trend is, I'd say that she's worsening because her ANO decreased from 4 to 3, um, or 3 to 2, I'm sorry, and her headache is worse. She's irritable to light, she's nauseous, she's not eating, but her pneumonia's improved. I'm not hearing anything there, so my recommendations are that to get the orders from the physician um, and to treat for symptoms of alcohol withdrawal, and try and get him to come and assess the patient as soon as possible. Also, you might want amylase test and liver enzyme test to try and prevent acute pancreatitis. Do you have any questions?